There was no one major academic IBD center in the state of Rhode Island, and often patients who had complex inflammatory bowel diseases, when they needed second opinions, sometimes had to drive up to Boston. So we decided that perhaps this is something that we should try to get into and offer for the patients of the state. I would say it's probably the first of its kind multidisciplinary collaborative group that we are trying to establish out here. I think the big strength that we try to focus our practice on inflammatory bowel diseases. Within the field of gastroenterology, there are various subspecialties, and given the pace at which science is advancing, sometimes it's hard to keep up with everything. And we focus all our efforts, research, education, continuing medical education on learning about upcoming treatments and paradigms for inflammatory bowel diseases. We also try to provide preventative health services. So, for example, vaccinations to all our patients, because we realize vaccination is a big part of care of IBD patients. We've worked with our organization, with the state, to secure vaccinations, even for patients with non-commercial insurances, such as Medicare or Medicaid products. And we accept most insurances, if not all insurances provided by the state of Rhode Island.
There wasn't anyone really who was focusing on IBD. There was a lot of people who were managing patients with it, but not taking it on as their own kind of interest. So the idea was to kind of learn from someone who's been in the field for a while and specializes in only seeing IBD patients at Beth Israel, kind of take what they've learned and kind of share it with me, and so I could bring it back here for patients and then offer those complex cases for patients who have inflammatory bowel disease, so they don't have to go up to Boston, they don't have to travel to New York. We wanted to try to keep them within Rhode Island, since a lot of the Rhode Islanders don't enjoy traveling too far. So the idea was to give excellent care to patients with IBD here and keep them at home. All the surgeries we offer here in Rhode Island at Rhode Island Hospital or the Miriam Hospital with our excellent colorectal colleagues, so they don't have to go outside of Rhode Island to get those done. It all kind of comes down to making sure that patient feels comfortable, ease of access to kind of come in and see us and get their appointments done. We're also within a big foundation, so we work closely with our primary care doctors. So we actually like to see our patients kind of under one umbrella if we can, so we get them the care with our primary care doctors. We have dermatology, we have our colorectal surgeons, so they're kind of getting this in-house care where we can all keep all facets of care under one roof, and everyone can kind of stay up to date with what's going on with the patient. So it really is kind of the best way to treat these complex cases, so that everyone knows what's going on and we can all stay in close communication with each other. Now that we're dealing with COVID, we've come along to use telehealth in caring for our patients. So early on, we took on doing telemedicine, being able to talk to patients, address their concerns, being able to communicate with patients how they're doing in a timely basis, where they don't have to leave their office, they don't have to leave their home if they can't. Even though it's come about despite COVID, it's a positive thing, and at Brown in our IBD center, we use it wholeheartedly.